asked me to talk about palliative care, pressure ulcers. So in palliative care settings, how do we manage pressure ulcers? That's what we are going to see. Because the wound is the major part in palliative care, and it takes the various forms and depending on the patient needs and the caregiver needs. And it is a major task, especially for the nurses, those who are working in the setup. And especially when you see the bedbound patients for a long time, pressure ulcer is the one is unavoidable. So how we can prevent in case if pressure ulcer come, how can we manage all these things we are going to see in this session. Though this is the overview of this session, we'll just first start with, since it's a part one, I just wanted to say what is wound, what is palliative care wound, what are all the types, how do we assess, and the management. So when it comes to the management, my focus is only on pressure ulcers. So this is what the wound, what you all studied in your basic nursing, any cut or break in the skin, which is called a wound. It could be, might be because of the surgical or could be because of accidental. So if you look into the prevalence, the acute wounds are more. It is come in 1,000 population, 10.5 per will be in 1,000 population with acute wound. The chronic wound is less, which is only 4.5 per 1,000 population. But if you, this is only a Indian statistics. If you look into that, that 4.5% will create lot of problem. The 10.5, what happened, you know how to manage acute wound, you know how to provide care, but you also know if you take care of that wound, the patient will get healed. The patient will become normal. They can start the routine. But in case of acute wound, which is not going to happen, the patient will be, the wound will be there as it is. The problems will be there. You have to work a lot. So that's how the management is going to be little difficult when you handle chronic wounds. So our focus in palliative care is focusing on the chronic wounds, not the acute wound, chronic wounds. That's how in part 2, you will see in detail about malignant wounds. And apart from that, in palliative care, the most of the population is terminally ill group and with the life-threatening illness. So how to manage bedridden patient with the pressure ulcers, that also we are going to see. So why the palliative care wounds are so important? Because which is very complex wound, it's very dynamic, and it involves the balance between not only the patient, it's also the family member. Do you think only the patient is the sufferer? The family member will be also a sufferer because they have to provide constant care to the patient. And according to the Indian context, the family caregiver is not a professional caregiver. They're bound to become a caregiver because of their loved ones. So they don't know what to do, and it affects the circles of the care, and patient also affecting. So how are we going to manage all these things? So look into the types of wound. When you come to palliative care, unlike other specialties, you have different types. Here, the malignant wounds are the major focus because most of the cancer patients will come for palliative care. All the patients will have wound which is fungated, which is granulated. It gives huge task for the healthcare professionals. On the other hand, which is equally important, the pressure ulcers. It is not only a terminally ill patient, any bedbound patient, they develop a pressure ulcers. On the other hand, one more thing, yesterday when I was talking about doctor, I talked about all the ulcerative wounds, how important to take care of these wounds, even the non-cancer patients. So this is the major focus in palliative care. In today's class, let us focus only about the pressure ulcers. So the goal here is not necessarily to heal the wound in palliative care. The goal here is how are you going to manage the symptom? How are you going to make the patient so comfortable? And it will be in a situation of not treatable. Then how are you going to communicate with the patient? How are you going to handle their psychological issues? That is the goal here. Look at this real life experience. This is the one what we heard one of the day during our rounds time. So the patient said, see, there is a wound, there is a drainage, there is a exudate all the time, which is smelling very badly. I can't go out with this wound. I need to cover, right? And family, nobody wants to next to me. It's affecting me so much. So this is what the patient said, I don't want to live or I don't want to have this wound. So this is what the patient said. It was very painful dialogue. And the family caregiver said, So she is a daughter. She said, I love my father. My father did so much, but I'm helpless. At the same time, I can't stand. I can't able to see the wound. And I can't stand next to my father. It is so smell. Foul smell. I feel so nauseated. So I don't want to do that. It is not with a lot of cry, she said. So this is the real life scenario, what you see every day. It's from the patient as from the caregiver. So when it comes to palliative care, you have to provide from the patient perspective as well as the caregiver perspective. Why it has become so important? Because when it comes to palliative care, it is all about why the wound is not healing. Okay, the evidence shows the patient is the wound is not healing because of various factors. One is because of the patient itself, the where the wound is located. Because imagine the patient is having wound in the vulval area, right, which is not going to heal, and the infection will become more and more and difficult to heal. And the patient, the site, that is what I said, the anatomical area, the patient pathology, the patient will have a lot of comorbidity, the patient can't take good nutrition, all these things will affect, the wound will become further to deteriorate. And apart from that, the wound related factor, the wound related where the wound is, how the wound bed is, which is very important as assessment you need to do. You need to assess the wound bed, how the wound is looking. So generally, if it is a fresh wound, it will be pinkish red color. If it is not that one, then you can see that is an infected wound, that is a fungated wound. The wound is in different stage. So these things you need to understand from the wound perspective. And the healthcare giver, our problem, how much we are knowledgeable, how much you are skillful. If you don't know to assess the wound properly, if you don't know to evaluate properly, if you don't know to stage it properly, how can you plan for your intervention? So the patient will get the wrong treatment, the patient will go with the infection, it develops sepsis, the patient might die even with septic shock. So we also one of the factor who create problem for the patient, and we don't allow the wound to heal. And the healthcare, this one resource facilities in the sense, sometimes the patient will be in tribal area, remote areas, they can't able to reach the facility, right? These are all four factors in the four corners affect the patient. And if the wound is healing, if the factors are not a barrier, the patient will go with the treatment. If the wound is not healing, again they have to go with the proper assessment. So it is very important, if you the patient comes to the palliative care, you can provide the basic thing is you need to have an overall satisfaction from the patient and the family who they receive the care from you. So your goal, if the wound is not going to heal, it's there. Your goal is providing comfort to the patient and provide all the symptom control. Okay, there is a wound, but the patient should be comfortable without any symptoms. And proper decision making. What treatment I'm going to give to comfort the patient. If the patient is coming with stage 4, your goal is not to heal the wound to 0 level. At least bring back to stage 3. At least bring back to stage 2. That is what you have to plan ahead. And what the concern, patient concern. I think hope you all studied in pain management. They would have talked about PQRST, right? Assess properly. When you assess, ask the patient what the patient want. So get the consent. And then you know decide on how to provide a quality of life, comfort the patient, even at the final stages. You may think the patient nurses can prevent bed sore, and some bed sores you can't prevent. That I'm going to discuss in the upcoming slides. So even till the last moment, we have to provide quality of life to the patient, those who are with us. Now we are going to start the wound, but where to start? How to provide a care? Start from past history. Your history is to be very clear cut. Use a PQRST scale. So start. It's not only for a pain, any symptom, either wound, dyspnea, or whatever it may be. So start with PQRST scale. Get proper history. When the wound started, why it is there, and how it is there, how severe it is. Either the wound is radiating or it's going to the multiple organ, how the wound bed is. Next, very important, as a nurse, your first thing is observation. Observe the wound before you do the thing. Observe the wound, how the wound bed is. The wound bed will give a clear-cut idea. Either the wound will be in a healing phase or the wound will be in a maintenance phase. And so then the evidence-based practice, whatever the intervention you are planning, plan accordingly based on the evidence. So that is what you are going to do. Then it is all about look at the risk. And if I do any treatment, how much of risk I'm going to face. Look at the risk of the patient. So when you start first, before you do anything, start with wound assessment, which is very important. It's not either it is a diabetic wound, it is a cancer wound, or it is a pressure ulcer. Whatever it may be, assessment is very important. The assessment is there in your hand, nurse's hand. Nurses will do the assessment. Like I said before, start with observation, then collect the history, ask the patient, do the physical examination properly, right? Then send for a culture, wound the blood test or whatever it may be, you can do the evaluation. Why we have to do all these things? You know how extent the wound is, how severe the wound is, and how much the wound creates a burden to the patient and also the family members. So all these things you will get an idea when you do the proper assessment with the wound. So why should we do the assessment? First, we need to know the cause, why the patient has got wound. Either it is surgical, either it is accidental, or either it is because of the disease, or either it is because of poor management of the patient. Why the patient has got wound, and what is the factor? If you know the cause, you have to find out the factor. For pressure ulcer, I will tell in detail about the factors. And then once you know this one, first correct that one. Okay, correct the cause, treat it accordingly. Then identify the appropriate treatment options, what we can do. If I want to only control the pain, focus on that. If I want to control the bleeding, focus on that. If there is no much symptom, I have to maintain the wound as it is and maintain it. So your dressings will be different as per that you have to choose it. Then the further deterioration. So the goal is here is the maintenance, right? They should not go with further deterioration. What is the patient expectation and how much we can able to provide them? Psychologically, you make the patient to know it's supported and what the patient want. The overall, the principle of palliative care here is patient-centered care. So this is the parameters. So when you see, understand the cause, where the wound is, anatomical area, the stages. So you need, as a nurse, it should be in a fingertip, the stages of pressure ulcer. So what is the stage? By seeing the wound, you should tell this is stage 2, this is stage 3, or it is stage 4. And the phases of healing, how the wound is getting healed, the wound size, which phase they are there, what is the size, and presence of undermining. Undermining, there will be some hole or tunnels will be there that you have to find out. The wound bed, as I said, and exudates. Again is the problem. You need to do proper dressing for that. And whenever you do, it's not only a wound bed, the assessment, you should see the surrounding area. If the surrounding area is healthy, it means that the wound is it's not having any complication. If the surrounding area is unhealthy, maybe a edema or hyperkeratosis or inflamed, what happen? It shows the chance of infection, spreading of the wound. So that is also to be a consideration. You need to check that. And the peri-wound skin, as I said, then the presence of pain, which is very important. Whenever you go for a dressing with the patient, okay, and first check that whether the patient is in pain, the wound pain. If the patient is in pain and you start the dressing, none of the patient will cooperate. Next time when you see as a nurse, the patient will start having lot of fear or they run away, they don't come to the hospital. So addressing pain is very important before the dressing. So your management here is symptom management. So start with the symptom management, provide a holistic care. And this one, why I told that I empower the caregiver, you need to teach them. See, you can't keep the pressure sore when you take the stage 4, it will be in a years. 1 year you can't keep the patient only for dressing. So you have to teach the family member how to do the dressing, why it is important, how they can prevent complication, all these things. Let us see Anand. Okay. This Anand is a 42-year-old man. Okay, he was completely bedbound. Okay, he actually the life has become very uncertain because of this one-day road traffic accident. It happened 2 months ago, and post accident he underwent multiple surgeries and he was in ICU. And after lot of medical intervention, okay, his recovery has become complicated and he confined to hospital for several months. So because of his prolonged stay in the hospital, immobility, he developed stage 4 pressure ulcer. Nobody noticed unless he reached stage 4 pressure ulcer, especially on his sacral region. Okay, so the nurse in the palliative care, okay, as a nurse in palliative care, what is your key aspects? This is what I want to ask you. So how do you care? How do you provide? That is what we are going to learn. So it is very painful burden for patients and clients, whatever it may be, the pressure ulcers. Okay, it has caused a lot of complications. It's not only a pain, the patient feel very uncomfortable, the quality of life and the cost. Okay, economically, the patient will have a lot of money they have to do for the dressing. Each dressing materials are very costly. So you have to see all these things. How can we help this Anand? Okay. So this is the definition of pressure ulcers. You can see. So it is according to the National Pressure Ulcer Advisory Panel. So they said pressure ulcer is nothing but there is because of unrelieved pressure, especially under the bony prominence, the skin will get damaged. This is what a pressure ulcer. So if you are going to the movie, sitting for long time and again watching the same movie, constant pressure, you get the particular area would be very warm. You can see the redness, you can see the irritation. It is called pressure ulcer. Okay, so it is not only a cause for the morbidity and mortality in the healthcare setting. It is also an important measure to know how our care is provided to the patient in the healthcare settings. So that is what the pressure ulcer. If you look into the epidemiology, okay, there are a lot of progressive technologies, successful clinical researches in terms of prevention and treatment of pressure ulcers. But the incidence shows 7 to 71%, okay, but the prevalence shows 8 to 53%, considerably, high mortality. And if you look into the pressure ulcer, exactly the long-term care, that is our overall incidence. You look into the only because of the care settings, so the patient, those who are in long-term care, you can say almost 23.9, 24%, and the home care patient. But if you look into the prevalence, the home care patients are more than the long-term patient. And you can see a lot of pressure ulcer in neurological patient because of the spinal cord injuries. Okay, there is a lot of, this is based on the evidence. So if you look into advanced terminal stage, the patient, those who are in bed bound because of the life-threatening illness, and they are in end of life, if you see 68% of the wounds you can see in palliative care units, especially pressure ulcers, and they'll develop directly stage 3, stage 4 because you don't know they are terminally ill, right? You don't know how they are developing, and the majority of patients, those who are in hospice, they develop within 2 weeks before death. And a lot of it correlates with the physiological shutdown of the body. So it happens because of that. Why the patient is developing pressure ulcer? What is the risk factors? So these are all the risk factors. There are two major factors. One is pressure, another one is a tissue tolerance. How pressure is causing pressure ulcer? The patient is not moving. See here, the Anand road traffic accident, completely bedbound, multiple surgeries, ICU, can't move, immobility, no activity, impaired sensory perception. He used to respond only with the painful stimuli. This is the reason. So he developed a pressure sore. The nurses in the ICU didn't see that. So they saw only Anand was gnawing and crying with the pain. They noticed they got stage 4 pressure ulcer. That is because of the unrelieved pressure. Then come to tissue tolerance. There are two factors, extrinsic factors and intrinsic factors. These extrinsic factors can be prevented by the nurses. It is there in our hand. If you provide a proper care, you can prevent extrinsic factors, you can prevent the patient from getting pressure ulcers. So the first one is moisture. So moisture is a common problem where patient will get pressure ulcers. It's because of the incontinence. The urine will be dribbling, always the wetness. This what happened? This incontinence will take away the oil from the body. The oil is like factor which prevents the skin and this one to not to attach to. So what happens? So this so directly the skin will attach to the connective tissues. The patient will get pressure ulcer. And the second thing is friction. So this is also in your hand because you all know how to do bed making. So when you do bed making, the teachers used to say it should be a clean cloth, it should be very neat and tidy, it should be tucked well, no wrinkles in the bed. Each and every point is important. So what happened? This friction occurs, okay, because of the skin and the sheet will have a contact. So what happened? There will be abrasions, okay? It causes pressure ulcer. So when you do the bed making, position the patient properly, put your both the hands under the patient and remove the sheet. Okay, don't leave the patient in supine position and pull the sheet. That causes pressure ulcer because that creates more of friction. The next one is shear. The shear is rubbing of the skin and the fatty tissues, okay, across the bones. When the patient is cachectic, it's very common, and it is also very common when the patient are lying down. When they lie down and if the head of the bed is raised, this what happened? This neck, the skin and the bone will be touched together. So it will be a damage shear and the fatty tissues stay in a long time. And this force caused a shear and the patient will develop pressure ulcer. So this is the basic risk factors. The major two is pressure in case of bedridden status. Tissue tolerance, extrinsic. You can prevent moisture, friction and shear. And the extrinsic factors because of the patient poor nutrition, patient will be on tube feeding, patient will be on CA cancer, esophagus they can't swallow, lot of things. The nutrition will have demographic area, some places will be continuously cold and rainy, oxygen, poor oxygen in the body, patient will not get good tissue perfusion, and skin temperature and all chronic illnesses. So these are all the reasons why the patient is getting pressure ulcer. How they are getting pressure ulcer? That is pathology. What is the pathophysiology? So all these factors act on the soft tissues, okay, under the body prominence. So it creates lot of pressure, okay, unrelieved pressure. It exceeds the normal capillary pressure. The normal capillary pressure is 35 mm of Hg, which exceeds more. It starts the occlusion and tearing of the small vessels. So it reduces the tissue perfusion, as I said, and it starts ischemia. Patient will develop pressure ulcer. So why? So if I lie down in long time, what will happen? This will happen. So the common sites, you all know, we all studied this. If the patient in supine position, all the bony prominence under the skin will be affected. And if the patient in side-lying position, greater trochanter will affect more. And the patient in prone position, same positions, even the toes also will be affected. So if you look into the study, if you based on the anatomical location, in which area is affected more? Sacrum. Sacrum is the commonest area where most of the patient develop pressure ulcer comparatively with the shoulder areas. How to identify the risk? How to identify the patient is prone to develop pressure ulcer? Use this scale. Braden scale is you have lot of scale, Norton scale, water flow scale. These are all the scale after pressure ulcer come use. This is the scale, is a risk assessment scale. If you use this scale, assess the patient, you can prevent patient developing further pressure ulcers. So the scale is, it has got 6 parameters and will be rated in 4 items. So the sensory and the mental, the moisture, the patient activity, mobility, the patient nutrition status, friction and shear. So all these factors have to be analyzed and score should be 23. In case the overall score, in case if the patient is getting score 19 to 23, there is no risk of developing pressure ulcer. 19 to 23, no risk. If the patient is getting 18 to 15, mild risk of getting pressure ulcer. If the patient is getting 14 to 13, moderate risk. If it is 12 to 10, high risk. If the patient is getting a score less than 9, there is severe risk of developing pressure ulcer. So if the score is more, no risk. If the score is less, risk is more. This is why it was like ulta. You need to understand the Braden scale. How do I know the patient is getting? These are all the warning signs. You can see the discoloration in the skin, sudden redness will be there. Once you see the redness, you start to react. Okay, the nurses should start to react on the red on the skin, any spot. And if you touch the patient, you can see there will be a warmth and the area will be very firm to touch. Okay, you could see the small blisters, cracked skins. So these are all the warning signs, especially under the bony prominence, the patient is prone to develop pressure ulcer. So these are all the stages of pressure ulcer. There are 4 stages in pressure ulcer. Stage 1, stage 2, stage 3, stage 4. You can see the first layer is the skin. So you can look at the pressure here, how the soft tissue is arranged and the bone. Okay, let's see what will happen in each stages. In stage 1, the skin will be there. You can see only redness, the skin inflammation, some blisters, the skin is warm, non-blanchable skin. That is what stage 1. Okay. In stage 2, the skin is opened. Okay. There is a break in the skin. The skin will not be there. You can see the dermis and epidermis is affected. So that is what stage 2. When it comes to stage 3, there will be no skin. There will be no dermis, no epidermis. You can see the muscle. Okay. You can see the muscle. In stage 4, loss of skin, loss of dermis, epidermis, muscle, and you can see the bone here. Can you see? You can see the bone here. So the cartilage, tendon, bone, everything you will see. This is how the stages are given as per the National Pressure Injury Control Unit. Apart from that, there are one more stage, that is deep tissue injury. It means that the skin will be even, that is next to stage 4. The patient's skin will be like that. There won't be any damage. But inside the skin, this dermis, muscle, everything is inflamed. You could see the purplish brown in color, okay, maroon color. So that is how the skin looks. So that is stage unstageable. That is deep tissue injury. The patient will have severe pain. So the patient will get lot of trouble out of that. And in case of unstageable, this is unstageable. You can see the scar, the bone also involved. You can see the scar, it is necrosed. The patient will have severe necrosis, the black or dark brown in color. Either it will be hard or soft. This is something called scale ulcers. Skin changes at the end of life. This one. Scale ulcers. This is also called Kennedy terminal ulcer. This is also called 330 ulcer. Why it is called this? This ulcer was found by the nurse Kennedy. She found it and she came for duty. She found it. When I went, it was not there. But when I came, it is there. No, something is wrong with the patient. That is why it was named like Kennedy ulcer. So why it happened? She was telling my care was good. I provided a good care, but still the patient has got a Kennedy ulcer. Why? So this is, this ulcer is defined in 2008 by the expert committee members. Okay, expert committee members. They said if the patient is having a skin failure and, the body, when there is end of life care, the last 14 days, there will be a lot of physiological shutdown in the body. The patient will deteriorate, right? And what happens? The patient, they developed this ulcer. So this is like a piece of spear or horseshoe shape. So there will be, black, purple in color, and you can't find the origins properly. A patient will be deteriorated, and it will be there inside the body. You don't notice only. So this is what called Kennedy pressure ulcer. It's not because of the nurse's poor care. It is because of the patient in dying stage. So we saw what is pressure ulcer, how to assess, what are all the stage. So your first criteria is prevention. So what is your goals of prevention? So when you want to prevent pressure ulcer, tell the patient to move a lot. Okay, they have to change the position, they have to move, and pressure avoidance. Tell the patient not to sit in same place. Equally, they have to distribute the pressure into the body, and how to remove the pressure positioning. Right, we do different positions to remove, and I'll tell you the pillow rules and all there that you can use, and how can you distribute the pressure? Either the patient, could be in air bed or water bed or whatever it may be. And you have to educate the family, because when your patient are there in the hospital, you can, do this one properly. But when the patient is get discharged, go to hospital, family doesn't know important of changing position, and every two they think that, oh, he's sleeping, no, he's comfortable, let him do. But it's important to change the position. So these are all the strategies of prevention. So the maintenance phase, right? So check the skin integrity. When you give the sponge bath, that is the ideal time. Check the skins, touch the patient, feel it. If you note any abnormality, immediately you document it. And proper bed making, very important. Nurses should do proper wrinkle-free bed making and examine the skin and pressure points, I said. Pressure relief techniques. Okay, sometimes the pressure is there in the ankle region, right? How do you can provide the gloves filled with ice water and keep, okay, there won't be any friction between the bed and the patient's skin, and keep some rings under the ankle. Okay, all these things you have to provide. Okay, then the position has to be changed every 4 hours. If the patient is on bed, the position has to be changed every 2 hours, sorry, every 15 minutes if the patient is on wheelchair. And good hydration is important. Patient will not eat, patient will find difficult. You have to encourage the patient to eat more, and good water supply, and minimize the extrinsic factors. Like I discussed, the extrinsic factors like the moisture, shear, friction can be prevented by the nurses, and educate the patient and family. Sometimes patients are very educated, family doesn't. Sorry, family is very much educated and want to cooperate, and the patient will not cooperate. So you need to educate both of them equally. So this is the overall management. So our goal is here is prevent pressure ulcer. In case if the patient get pressure ulcer, this is the management. So in stage 1, the patient will have pain, bleeding. The patient will have itching. You can see the darkness. Okay, all these things. And the best thing is clean the area and use the mild soap and water. And the patient, keep the area clean. All these things you can do with the patient. And if the patient in stage 2, what happened? Stage 2, the patient will have swellings. You can see the warmness, it would be red, skin will not be there. The patient will have pus sometimes. So you clean it with the normal saline and maintain the moist environment by selecting. There are a lot of ointments are available in the market, which is very good, and dressing materials you have to choose appropriately. And apart from regular dressing, these advanced dressings like Comfil Plus, biotin foam, alginate dressings, and hydrocolloid dressings, all these dressings are very much helpful to heal the pressure ulcers. So the recovery time is 3 days to 3 weeks in case of stage 2. When it comes to stage 3, you can see the big hole. You can put one hand. Okay, inside the pressure ulcer, the infections are more. There won't be proper edges. You can see the rough edges in the patient, and there will be a foul smell. You can see the exudates, and the patient, the patient can't eat properly. Okay, all these things. So in this stage, your management is, if the patient is in curative phase, you can do the debridement. The patient in end of life, you can't do that debridement. You can just keep the wound clean, keep the patient comfortable. So do the debridement, do the alginate dressing, start antibiotics to prevent prevention, and you give the special matrices. It is 1 to 4 months, the recovery period. When it comes to stage 4, there will be a black skin, right? Around, you can see the bones, it will be very tender, muscle lost, everything will be there. Same debridement you can do if the patient is in condition is good. If not, you can do the palliative management. Alginate dressings are very nice and proper antibiotics will help and the special mattresses. So it will be long period, 3 months to 3 years. When it comes to unstageable, there won't be any proper management. The wound is very bad. You can see the slab, scar, and all those things. Your only thing, you keep the wound clean. Clean the wound properly, keep it, and regularly do the same thing, not to get any kind of infection. This is what management. Now, what are all that self-care tips you can give it to patient to prevent pressure ulcer? First thing is pressure relief technique. If the patient sitting in the same position or laying down is that same position, tell them to relieve the pressure by lifting themselves from this place to another place. Changing, if the patient is supine position, change to right lateral, left lateral. So different positions. Okay, you need to relieve the pressure. And skin care, which is very important, especially the place like Bengaluru and all, always cold, like different weather, the skin will be very dry. So this one is keep the skin moisture, okay, keep the skin healthy, which is very important. If you do the proper skin care, you can prevent pressure ulcer. And bath daily with the mild soap and water. And areas, if you taking care of the patient, go sit to the patient, touch the patient, talk to the patient, and see that if there is any redness or warmth is present with the patient. And pay attention to fingernails and toenails, because if accidentally if you touch, the patient will start to bleed, starts with infection and all these things. Position the patient, right? So your position is very important. Give different position. And like I said before, wrinkle-free bed, proper good water and adequate amount of food the patient has to take. And getting sunburn. Okay, the patient, avoid the patient to get sunburn, keep as well as active for the patient, which is very important. So we discussed so much. What about our knowledge about pressure ulcer? It is very recent study done in India, the nurses' knowledge and attitude in the prevention of pressure ulcer. The result is very shocking, very insufficient knowledge with the nurses. It's only 45.5%. And the attitude is very bad because of the nurses. It's almost 68% in prevention of pressure ulcer. So they know they concentrate on other procedures. They don't know the preventive aspect. The study revealed the truth, what's happening in India. And what they have concluded that saying the nurses need to have continuous education. That's what in your course, one of the major nursing issue, pressure ulcer. As Shiba initially said, no, in palliative, there's so many nursing issues. One of that, it's not only one of the issue, it is a major and common issue, and take care of the patient and practice of the nurses, how the patient nurses are showing their practice with their knowledge and attitude is again the important factor. So it is all in our hand to get adequate. We should not be the factor for the patient wound to become worse. So we have to have a good knowledge and skill. So your role is the first thing as a nurse, assess. I'll keep on telling. It's not the assessment done. Assess, reassess, reassess. So that's why daily assessment is very important. Before you start the rounds, do the assessment properly. Touch the patient, look at the skin, give skin care twice a day, inspect the skin area when you do, check and see is there any changes in the skin, and palpate, touch and see is there edema, the dry skin, something is there, and evaluate the mobility of the patient and take a nurse's support, make the patient to move, take the patient to wheelchair, make them to sit, change the position, check their circulatory status, how good their this one movements, if the patient is having any edema or something, and the neurovascular status, because if the patient with a neurological condition, they have to be bed bound, right? You need to assess them and determine the presence of incontinence. It's very important. Most of the patients, they feel very shy, they will not tell. But these incontinence, take away the skin. They can't create lot of burning, redness, and take away the skin. And you need to evaluate the good nutrition and hydration. And if it is any problem, note it down in your diary and inform to your team senior members. So when it comes to pressure ulcer, you need to understand the rule of 30. Okay. So the head level, head of the bed, okay, it's not to be elevated more than 30 degree. If you do that, it should be 30 degree or below 30 degree, because to prevent the bed sores in the sacral region. Otherwise, the patient will get more sacral pressure ulcers. So there should be hips and shoulder should be 30 degree from the supine position, and support with the pillows in the benches. The patient should not fall, which is very important. This is called rule of 30. There is something called 5-pillow rule. 5-pillow rule means you have to put 5 pillows when the patient with pressure ulcers. So what happened? 1 pillow under the leg, 1 pillow in between the ankle, 1 between the knees, and 1 at the back side, 1 at the head. So whenever the patient changes position, you can change the pillow also. So this is called 5. Remember the rule of 30 and remember the 5-pillow rule. You need to understand as a skill. Okay, like 5 fingers, you need to remember the surface, the skin, keep your patients moving, incontinence, nutrition, hydration. Surface, make sure the patient has got good support, either in the hospital or patient, and good bed making and everything. The skin, inspect. From beginning, I am telling, inspection is very important. Early inspection should be done and early detection should be done, and show patients and carers what to look for, and keep the patient moving, which is very, very important in palliative care. Nobody likes to lie on the bed. Keep the patient moving. And the incontinence, I discussed a lot about incontinence. So keep the patient to be clean and dry. And the nutrition, good nutrition, help the patient to have a small good nutrition, to have adequate fluid to maintain the good skin. So this is all about pressure ulcer. What is pressure ulcer? What are all the stages? What are all the complications? How the nurses should move? Apart from this, the patient will also have a lot of psychological issues. It is not only pressure ulcer. It is about my body image. Okay, I got a pressure ulcer on the sacral region. I can't tell to anybody. Okay, if it is somewhere elbow, I can show. How will I show? They feel very bad. They can't come outside. They have a lot of depression, anxiety. So today we are telling the technology is improved. How many of the patient is coming to hospital? It's always a challenge. They will not come, they will not expose, and it will affect their sexual life. They feel very shame. They have the fear of death. They'll have isolation. And social problem, as usual, I said both the things, stigma. The patient has stigma. There will be a lot of effect on the family, especially if they are married, the relationship will go. Spiritual concerns, the patient will think, and everybody is normal, why I am suffering? So they have a fear of impending death, and a lot of dilemmas will be there. So your goal is not only to provide care to the patient, your goal is also to train the caregivers. Because caregivers, you don't know from which background they are coming, what is their need. The gauze, do like this and apply. They do, where do they go for a gauze? How do they do? All these things are very important. And whenever you show it as a demonstration. Don't tell to your patient, you go tomorrow, do the dressing, you tie like this. If you tell, they will not remember. So when you are planning for a discharge, call a patient 4 days before, tell them to join for a dressing rounds. You show the dressing, and when they go back home, they will follow the same thing. And practical demonstration, regular follow-up. If you can't go, link it with the home care team, whoever nearby, they will go and see the patient, make the patient to be very comfort and quality of life. And you as a nurse, you can teach, because I told you that most of the families could not able to afford for their expenses. You can teach small preparation of how to prepare nurse, how to prepare dressing materials and all these things to help the patient to avoid economical cost. So the bottom line here is you need to design your dressing properly. So the design should be the contact layer. Okay, it does not hurt the dressing when you change the dressing, when you due for other dressing, and there should be good space filter for deep wounds, and the nutrition has to be maintained, the moisture has to be maintained, protect the skin, and the bathing rules with the pressure ulcers, you have to teach patient maintain how to maintain pain management, and the underlying how to manage the underlying cause. So basically, you are going to clean the wound, you are going to cover the wound, you make sure the wound is moistened, and make sure you have a waterproof dressing and you are protecting it. So this is the bottom line for a pressure ulcer wound management. So the key message for this session today is examine the whole patient, not to see the hole in the wound. Okay, it's not only a hole, you have to see the whole patient. That is what I would like to say. So Florence Nightingale, for a nurse, she said very clearly, if any patient gets pressure ulcer, that is not because of the disease, that is not because of the food, that is not because of the food, it is because of the nurses. It's your poor care. Any patient can develop pressure ulcer. So it's all in your hand. If you provide proper care, if you prevent extrinsic factors, you can prevent 90% of the pressure ulcer. In case some things like Kennedy ulcer, you can't prevent, you have to manage it. So it is in our care, nurses should provide a quality care, good nursing care for the patient to prevent pressure ulcer. So this is all about pressure ulcer. If you have any doubts, please ask me.
Thank you, Sangeetha, for the excellent session. Anybody have any doubts? Anybody have any doubts?
I have seen something in the chat.
Yeah, one question. So, explain about holistic care.
Yeah. So the holistic care, it's a very good question. As a palliative care professionals, you need to know when you learn the basics. Okay. So the patient will be in a curative phase. So you can start the palliative care. But in the hospital setting, they will take care of only the physical aspect. The patient is having wound, you have to do the dressing. Again, time will come, you have to do the dressing, do the wound assessment chart. But when it comes to holistic care, not only with your dressing, that's what I discussed about the emotional aspects of the patient. What the patient is feeling because of the wound. How is the family is isolated them, or is the society isolated them? And the patient is having any spiritual concerns, like patient will tell, why I am suffering like this? Why God is punishing me? What did I do to anybody? So these are all the common questions patient ask. So when you handle it in palliative care, look into the 4 dimensions and focus your care. You have to plan your care in such a way, if you plan accordingly, that you can provide a holistic care. And one thing, this holistic care, you can't be providing only by you. You need a multidisciplinary team approach. As a nurse, as a doctor, you can give only a physical care. Maybe when you do the dressing, you can communicate with the patient. But when the patient is going in a detailed level, you need to have a support system. You need to call your counselors. You need to call your social workers, some support. You need to have your senior staff, because you cannot able to explain everything. So always palliative care, you need to have a multidisciplinary team, good team approach to provide a holistic care to the patient. All right.
Thank you.
Yes. Anybody else is having any doubt?
So we have around 84 participants, 83 participants, right? 91 participants.
91.
Yeah. Please ask questions.
If not, I will ask.
Yeah.
Anybody? You can raise hands or put it in the chat box. Okay. If not Shiba, we can go to the case
Yeah, so the thing is, the case presenter is
Yeah.
not joined today. She is having some network issue.
Oh.
So I think we can share that
Presentation.
presentation. Anyone can please read it out so that we can discuss.
Let me share the screen.
Yeah. Sister Veronica, please read this patient story. Please
muted.
Please unmute yourself. Yeah.
Patient age is 65, gender male, diagnosis stage 3 bed sore, secondary diagnosis sepsis, presenting complaint severe pain and discomfort in the lower back region, history of illness, was admitted to the hospital with a 3-day history of severe pain and discomfort in the lower back region, fever 102 degree Fahrenheit, chills, fatigue and difficulty moving due to pain. He reported a recent hospitalization 2 weeks prior for urinary tract infection. He had been experiencing increased immortality since then. He also mentioned a history of diabetes managed with insulin, hypertension, spinal cord injury 5 years ago, resulting in partial paralysis and mobility issue. Examination. On examination, skin, location, sacrum, stage was third pressure sore measuring 4 centimeter into 5 centimeter. Appearance, open ulcer with sloughing and drainage, surrounding skin, erythematosis and indurated. On treatment and significant investigation, on treatment, pressure, redistribution, specialized mattress and turning schedule, wound care, debridement, dressing changes, and antimicrobial therapy, pain management, analgesics and pain relief medications, infection management, antibiotic and fluid management, nutrition and hydration support. On investigation, complete CBC count, blood culture to confirm infection, renal function test to assess organ function, wound culture and wound biopsy. Psychosocial aspect, pain management strategies, emotional support and counseling, encouraging independence and autonomy, addressing body image concerns, promoting relaxation technique and sleep hygiene. Medication, antibiotic, pain management medicine, ibuprofen, debridement agents, collagenous, topical cream, wound care dressing. Main concern is preventing infection, promoting wound healing, and managing pain. Summary: pressure sore are a serious medical condition that require prompt attention. Main concern includes preventing infection, promoting wound healing, and managing pain. Early detection and appropriate wound care are crucial in preventing and treating pressure sores. Medications such as antibiotic, pain management drugs, and debridement agents may be used to manage pressure sores. It is important to seek medical advice from a healthcare professional for proper diagnosis and treatment. Discussion points. What causes pressure sore? How can we prevent them? What are the different stages of pressure sores? How are the pressure sores treated? How can patients take care of themselves?
Thank you, Sister Veronica.
Welcome.
For read out this patient story. So actually, I was asking her to rewrite the patient story because need no clarity. So no psychosocial issues because we need to find understand psychosocial issues also. And one more thing I would tell you all is pain. We learn about the pain management, pain assessment, and all. So hereafter, if you present a patient story with pain, you have to defined about the patient's the pain introduction that like PQRST, so that we should know what is the type of pain, what is the pain score, that what was the what medication, is there any provocating factor, is there any palliative factor. So these all things we should know. So we have to understand the type of pain. Based on the type of pain, we have to treat. If the patient is having neuropathic pain, we have to give some neuropathic pain management. If the patient is having nociceptive pain, we have to give some nociceptive pain management. So these things we need to understand for effective pain management. So that all things you have to keep it in mind while you prepare a patient story. So and Sangeetha, anything you want to ask?
Yeah. So they have to discuss now. All the things are covered in the session. So you can tell what are all the causes of pressure ulcer. Anybody in the group?
Moisture.
Yes, very good. Because your case is very detailed case, like bedbound for a prolonged period, spinal cord injury. Very good. Then is the only cause moisture?
Others, please respond.
Very good. People are responding in the
Okay,
chats.
thank you.
Yeah, immobility, spinal cord injury, there is a friction, shear, malnutrition. Excellent. So all these things are lot of factors. Whatever we studied in this patient, you have seen. So that is the reason why the patient is in because of dehydration, because of immobility, they were in the bedbound for prolonged period. He developed a pressure ulcer, especially you could see the stage 3. Right? How could you prevent that? Yes, advanced age, that is the cause. Changing position, very good. Changing the position, very good. How frequently you need to change?
And bed too early.
Application of oil, no talcum powder, okay? Yes, mattress, every 2 hours, exactly. When the patient on bedbound or bedridden state, every 2 hours. Which mattress? Mattress is coming.
Air mattress.
Air mattress, water mattress.
Water
If
mattress.
patient is affordable, you can even opt for a water beds. Yes. Very good. So these are all the preventive aspects and make patient to have a good hydration, nutrition, use of pillows, very good. Different 5 pillow rule, positioning the patient, right? The how to rule of 30, right? Because your patient is having ulcer in the sacral region. If you don't position again, it will, because the wound is not small. They said 4 into 5 centimeters. So it's a huge wound, quite big wound. So avoid wrinkles in the bed. Yes, proper hygiene. Very good. Excellent. These are all the preventive aspects. So the stages of what are all the different. Now the patient is in stage 3. What are all other stages?
Stage 4.
Stage 4 is there. If you don't provide proper treatment, they will go to stage 4. So other stages? Can somebody explain about the stages, different stages?
No, sir.
Hello? Yes. It's not 5 stages, 4 stages actually. Unstageable is extra. It is not included as per National Pressure Ulcer Advisory Panel. There are 4 stages. It was extra added, unstageable, and deep tissue injury. Okay. Yeah. So these are all the 4 stages. You need to know as a nurses, like I said, it should be in a fingertip. So in stage 1, it will be the skin will be there. The patient will have redness and pain. Stage 2, no skin. Stage 3, no skin, no dermis, no epidermis. Muscles will be there. Stage 4, everything will go. You can see the bone. And unstageable, you can see the necrosis, slough, scar, everything. And deep tissue injury, the wound will be purplish maroon in color. Okay, inside it will be damaged. Okay, how can you treat this pressure sore? In this case, let us discuss in this case. In this case, the patient is having stage 3 pressure ulcer. As a nurse, how do you treat? Anybody, just unmute yourself and talk. Okay, proper hygiene. Somebody can unmute and talk. Explain. Because writing will be so much here. Dressing. What dressing you will do? Yes? Betadine. Okay. How do you do the dressing? I can call somebody. Divya. Divya Desai. Can you explain? Divya Desai? Divya, are you there? Yes. Tell me. How do you treat stage 3 pressure ulcer? Nobody is talking.
Please unmute yourself and talk. We are nurses. Please talk.
Biggest problem of the nurses.
Divya?
Divya Desai, I called.
Can anyone please talk?
Gautami Nayak. Okay. So in case of stage 3, what you have to do? You have to clean the wound as usual. And what happens in this stage 3? You can use Mehail for the patient and Deprides, Healase. So many ointments are there with that. And if there is an infection, start with the antibiotic and do the dressing. Okay. The dressing to be always non-adhesive dressings are very efficient for the patient. And if the patient is affordable, you can also use alginate dressings, Comfil dressings, because what happens, these dressings will stay for 7 days.
Hello, ma'am.
You don't have to, yes.
Hello.
Yes, Divya Desai, yes.
Hello, ma'am. Yes, ma'am. First of all, we have to comfort the patient. Then we have to take care of the wound. As in, we have to do the dressing. Proper dressing using septic measures is a must. Then we can also send the blood routine for checking if the patient is having an infection, culture, and all we can send. Uh, while doing the dressing, we can use antiseptics. Different types of antiseptics can be used.
Good. This is very good, Divya. Thank you so much. So these are all the regular management for all the stages, what Divya said. So when it comes to stage 3 and stage 4, if the patient in curative stage, even the patient can go for debridement. And if the patient can't go for debridement, then you can follow some autolytic debridement measures. So that's how you have to treat. So can somebody tell about how the patient can take care of themselves? The tips. What tips you can give? This you can put it in chat box. Yes, barrier cream, very good. What barrier cream you use? One example. The best barrier cream is beesore oil. Okay, B for basket, beesore oil. It's very good. Okay, good. Aseptic technique patient will not follow, no. The patient self-care management, how to take care
Keep themselves dry.
Yeah, keep the patient, the wound is dry, very good. Boost self-esteem, okay. Proper health education, what education? Not wet the dressing, very
Proper
good.
nutrition.
Good nutrition, very good.
Change of
High protein
position.
diet, yes. Loose clothes, very good diet. Self-mobility, excellent. Hygiene, very good. Any other thing? Yeah, hygiene, diet. No sunburn, okay.
Wrinkle-free bed.
Wrinkle-free bed, excellent. Family members also, they can take care themselves. Very good. Educate the family members in the hospital setting so they can take care of the patient at home. Very good. Yes, hygiene and diet. Very good. These are all, the aspects of proper hygiene, specifically cutting nails. Very good. Does not cause
Observe the pressure point areas.
Yes, observe the pressure point areas. Okay, if there is any redness and those things. Very good. And I just want to go back to the slides. So can I see the slides? She has to wait another 15 minutes.
Sangeetha,
Ah,
which slide you want?
the previous slide, I was seeing something to ask, not this summary, before that, not this. Medications. No, come to medications. Yeah. So debridement agents, what are all the topical creams we can use? So these all you need to know as a nurses for wet sore, no? What are all the topical creams? Anybody? Put it in the chat box. What do you use? See, we can also learn different things. What is there in the advanced level? Betadine, okay. Exclusively for the bed sore.
Metrogel ointment.
Oh, that is for maladar. Very good. Next. I told you Mehail. Mehail is very good. That can be used. Yeah. Silver sulfadiazide cream. Yes. Mehail. Very good. Hydrogels. Yes. Yes. Debridase. Debridase is very good for this one. Yeah. Papaya leaf. Okay. Fentoin topical. Aloe vera pulp. Hydroheal. I'm not very sure of aloe vera pulp and all, but I don't know how effective it will be. Hydroheal. Okay. Good. And use debridase, healase. These two things are very good topical cream to heal the bed sores. Okay. Good.
Especially for the debridase ointment, if the patient is having any slough there, you can apply debridase ointment. This drug is good for removing the slough.
Yes.
After that, then you can use that Megacare. So that will help to improve wound healing. So, okay.
Never know about that. Okay, that's it, Shiba. Thank you, everybody.
Thank you, Sangeetha. So, we have a small video on pressure sore prevention, and even so we will try to show